All right. So good afternoon, everybody, and welcome to our information session on the Community Engagement RFP. My name is Donna Pettigrew and I am the Executive Manager for Health Workforce and Systems Improvement, which includes emergency response. So today we're looking at a community. Oh, hold on, close that. Sorry, we've got a bit of an echo here in our office. Just bear with me for a minute. Hope it's not echoing for you as well. So we're going, today's RFP, we're looking at some community engagement consultation around natural disaster and extreme weather events and the wellbeing and resilience and preparedness of our communities. I would like to start by acknowledging Australia's Aboriginal peoples as the traditional custodians on the land on which we all meet and work. We pay our respects and recognise their continued connection to land, water and community and honour their ancestors, elders past, present and emerging. So just quickly to go over what today will look like, we have allowed an hour for today because just to make sure we cover off all the questions. This is a bit of an overview of what we'll do today. Talk a little bit about the background of the grants and where that funding is coming from, eligibility criteria, the timeline for the RFP, and some tips around submitting requests for proposal through our portal. We'll talk a little bit about how the RFPs will be evaluated and also then open up for questions after that. I'll ask you to put your questions in the Q&A or chat. We will be monitoring both of those and they will also be downloaded for use later on. Most of this, a lot of you will know already, but I'm just going to go over what the Primary Health Network is. So the SNHN is operated by the Northern Sydney Primary Health Network, which is one of 31 primary health networks across Australia. We're established by the Australian Government in 2015 with the following objectives. We are to increase the efficiency and effectiveness of health services for patients, particularly those at risk of poor health outcomes, and to improve coordination of care to ensure patients receive the right care at the right place at the right time. The Northern Sydney Primary Health Network covers 9 LGAs that are there on our little map there on the left, and that it looks after approximately 1 million people across the region. So some background about this particular RFP. We're inviting community organisations to apply for grant funding to undertake some community engagement on the impacts of the recent extreme weather events. And we want that to include in that the wellbeing and resilience and preparedness for recovery and for future extreme weather events. This work will inform our future grant rounds. With grant 2, which is more around our community development grants. So this is a very important piece of work. We need some really good, solid information from our local communities to really make sure that we are targeting the community development grants well. So the objective is really to better understand the impact on the community of natural hazards generally, and what can enhance their wellbeing, resilience and preparedness of their communities, and the primary health providers. So primary health providers are considered, whilst they're sometimes not actually considered part of the general community, they are actually a community on their own, and they are very helpful to have them involved when we are looking at preparedness and resilience of our community. The target groups here, everyone's a target group, to be completely honest. So we do focus a lot on the vulnerable community members because we know they are at risk of worse health outcomes than most. But we also want, as I've already mentioned, we also want people to focus on their primary health providers in the region that may have been affected by the floods or bushfires in previous years, and other extreme weather events, storms, asthma storms, etc. So the total funding pool for this RFP is $400,000, and that will be awarded in its entirety in this first round. A little bit of background about these particular grants. So what we're needing is that organisations to conduct engagement with our community on the impacts of the floods, bushfires and extreme weather events. I feel like I'm repeating myself. I apologise if that feels like it for you too. And we are, again, interested in engagement with primary care, which includes GPs and allied health that work outside of the New South Wales state health systems. More broadly, we would like these activities to engagement to be looking at all areas of our region. So that includes the 9 LGAs that I mentioned earlier, and not all of the people putting in applications will look at doing all of the regions. You might need to just select ones that you are very familiar with. And we'll be taking all of that into consideration. If you are able to just do one area really well, that's great. If you are able to look at all of them, that is good as well. But all applications will be looked at to see what is going to actually achieve for what the best for our whole region to get really good solid engagement. As I've mentioned already, target groups are our vulnerable communities, but in any sort of a weather event, all communities are considered vulnerable. So that's, whilst we usually have our very clear vulnerable groups, our Aboriginal and Torres Strait Islanders, the young people, older people, culturally and linguistically diverse, and it says primary health providers there, but also our disability services would also be included in that vulnerable groups. But in the event of a weather disaster, then that vulnerable group means everybody. So in your proposal, we really would like you to outline who specifically you are planning to target. Just try and make that as clear as you possibly can. So there are 3 criteria in this particular RFP, and they are weighted. It will say so when you're filling out the information. It'll tell you what the weighting is on each of them. And the project plan is actually weighted at 50%, which is huge, but we do believe it is really probably the most important part of what you put in your RFP. So here we want you to outline what you're planning to do, and how you're planning to undertake this community engagement, including the sorts of communications you're using, the marketing strategy, cultural considerations that you may have to put into place. You will have to put into place, along with how you will engage effectively and with the vulnerable or hard to reach groups within those target groups. Include in your proposal the engagement plan and how it aligns with the following principles. These are outlined in the RFP in the Tenderlink portal. So how we're working with asset-based, community-led resilience building and collaborative sustainability. Be very careful to make sure you do actually put in here into this criteria 1 exactly what it is you are going to do, not just who you are and what you've done, but what you are going to do for this particular RFP. It's a mistake a lot of applicants make. Criterion 2 is looking at who you are and what you've done. So again, I'm not saying it's not important. It's really, it's got a 30% weighting. So if you have if you have got experience in doing this sort of work in the past, great. If you haven't got that experience, also, telling us that you haven't and that you're looking at, working with, you may be looking at working with one of your other local organisations or other particular groups in your local community that you have got good experience with. So it doesn't limit your ability to apply if you haven't actually done this sort of work before, but we're interested to know what your linkages are there and how that brings your application up. And criterion 3 is the budget. So we put just a very vague table there. It's really up to you how you produce that budget. It's probably good to have a fairly good breakdown of expenses that you expect to incur. And the grants, we said the grants are between $10,000 and up to $100,000. So it's serious money. So we really do want to know exactly how much you're planning to spend on what. Obviously, that would be estimates at this point. This is just around eligibility. So pretty much any organisation that has an ABN can apply for one of these grants. And as I said with the previous looking at the criteria, if it's an organisation that has a particular expertise with a particular cohort of community, it doesn't really matter how big or small that organisation is. If they have an ABN, they are able to apply. So the funding amount for the total is $400,000, which I've mentioned earlier, and the funding period is from the 1st of July to the 30th of September this year. Not sure why that last line there, it looks like a bit of a typo. Sorry about that. Reporting requirements will be agreed. It will be agreed, not between general practice, but between the applicant and SNHN. That would be outlined in a grant agreement. So this is a bit of a timeline, just to give you an idea of where we're at. The request for a proposal was released last Friday at 4 p.m. And this is the information session that we're in now. This information session is being recorded, but it's really only being recorded so that we can make sure we include all of the questions. Any questions you ask today will be put into the Tenderlink portal so that anybody that is applying has access to the questions and answers that were asked at today's information session. Those questions and answers will continue throughout the tendering period until Wednesday, the 15th of June at 4 p.m. So at which time no more questions can be asked. Those questions are made public to anybody who's logged in. Again, to be fair, to make sure there is plenty of transparency around any questions and answers that are given. And then SNHN will respond to those questions by 5 p.m. on the Thursday, the 17th of June. The closing date for submissions is the Monday, the 20th of June at 10 a.m. We would recommend that you start working on your submission offline and give yourself plenty of time to load your submission into the Tenderlink portal. There's usually quite a bit of cutting and pasting that is required to make sure that happens. And if you've not done it before, it can be a bit daunting, and we want to make sure it's really that everyone has the opportunity to make an application if they wish. So once the 20th of June comes along, all the proposals will be put under review and evaluated by a panel That panel will include some of the executive staff from SNHN, but also several external stakeholders with experience in the field. We hope to notify all applicants of the outcome of their application on Friday, the 24th of June. And then those that have been successful, they will have a grant agreement finalised by the end of June. Therefore, we'd expect the commencement of activity in July and conclusion of that activity by the end of September. These are just some tips for submissions. The very first one is pretty obvious, I know, but giving yourself plenty of time to make the submission is vitally important. Getting something in at the last minute that's always the time people end up having internet problems or an issue with the portal itself. Very important that make sure you're really well prepared. There is a downloadable application document, which you unfortunately can't just upload. You still need to cut and paste, but if you do that downloadable application form first, so you've got everything you need before you sit down to put that into the portal, it will make it much easier on yourself. That the rationale behind that is just making sure that everyone is a fair and equitable response to being able to get in and being able to have their submission looked at. Any late submissions have to be deemed as not being received and won't be considered. Responses have to come in by a tender link. Anything that is sent in by email to SNHN or to any of the personal inboxes here cannot be considered a submission. So that must go in through tender link. So as I said earlier, familiarise yourself with the grant eligibility criteria and the service requirements. And make sure you are clear on what the requirements are, and so you've got plenty of time to prepare your response. So when the panel is formed, even though some of the panel may know you or your organisation, not all of them will. So you really need to make sure that you're responding to the questions and understanding that people that are reading it may not know anything about your organisation. Be very clear about what you're proposing. Don't get too bogged down in lots of finite detail, but try just to be really succinct and be extremely clear to make it as easy as possible for the panel members to really understand what it is that you're doing or proposing. Be realistic. If you're proposing to do an activity in a specific way under a specific budget, you really need to know that you can do what it is you're saying you do. The budget document will help you a little bit with that, but also looking at the timeline, because it's a very short timeline. So please make sure you're being very realistic about the capacity and capability of your organisation to deliver on this proposal. Please emphasise your strengths and why we should be looking at you as a preferred applicant. Remember that you're competing with a number of other organisations, and you want to make sure it's really clear why we should be looking at you over somebody else particularly. Also, and this may be covered later, consider, if you like, if you think you've got some of the expertise but not all of the expertise, do consider talking to other organisations and potentially putting in a collaborative proposal. Make sure you or the named contract for your submission, make sure that whoever it is that is writing that submission, make sure that everybody in the organisation, or especially those who might be named on it, know about this submission. It happens occasionally where someone puts in a submission and puts their CEO's name on it, and CEO doesn't know anything about it. So when we contact them, they don't know what's going on. So just be really clear and open with your own organisation. If we invite you to interview, excuse me, you'll be required to talk and present your proposal. Sorry. Sorry. Please ask all your questions through the Tenderlink portal. It provides clarity for everybody, and it ensures that there's transparency for anybody else that's looking at putting in a proposal. And as far as that goes, talking to staff from the PHN, they are all have their, when we're doing things like this, they will know that they can't answer questions, and they will all direct you straight to the Tenderlink portal. A lot of this we've already covered off, but I'll just go over it briefly. Oh, someone's just bought me water. Thank you. Sorry about that. As I mentioned, the SNHN staff are unable to respond with verbal inquiries. Just keep any inquiries coming through. You will be answered, but it's really important that you that it's kept as fair and equitable as possible. Submissions have to go in online through Tenderlink. If you haven't already, I would suggest you register with Tenderlink as a supplier, so that you so that when you're ready to put your application in, you're already set up as a supplier. And there's a link there on this. There's also a link to set yourself up on the RFP that went out last week. Once you've put in your submission, you should receive a submission receipt that's got a time and date on it. If you don't, can you please contact Tenderlink, because it's good if that hasn't gone through for some reason, they need to help you to make sure it's gone through in plenty of time. As I said earlier, applications cannot be received or accepted by email. If you're having any IT issues, please use the Tenderlink support line, and they also have an online submission for issues. They don't tend to get back to you in the evening, so if you're putting something in, you might not get an answer till the next day. And if you don't get an answer straight in a timely manner for yourselves, please contact them through the support line. Some of these things around being the applicant. So, if you're putting in a proposal around your organisation has a different legal entity, just make sure all of that is correct within the RFP. And include the lead contact person and their role and phone number and email address. It just makes it easier for us when... also, just on that, make sure you're putting someone in there that is going to be available for, so particularly not someone who's going on leave in the next few weeks. Okay, so that is all the information we have. I've just got a question here from somebody. Does target groups of the grant include NDIS and aged care service providers and their clients? Absolutely, yes, it does. there's, the list is not exhaustible by any means, by any stretch of the imagination, and especially in some of our weather events recently. We know that a lot of our disability services, our group homes in particular, had issues with floods on the beaches. So yes, definitely NDIS and aged care are considered vulnerable groups. Any other questions?
So, Donna, there's another question that's just come through. Can we include attachments in our application?
Yes. I'm just trying to remember which criteria lets you put some in. I think there might be one. Ooh, I'll have to reopen it. I'll have to go and have another look at it, but there should be at least one of the criteria. There will be an area where you can attach a document. So if there's further information that you wanted to put in, there will be a possibility of doing that. I feel like it might be in the last criteria, which is usually about budget, but there could be another one. I will check that. And but yeah, most of our applications, we do have the ability to put that in.
Donna, there's a question. Are there word limits stipulated for each criterion?
There usually are. I haven't actually put this one up on the portal myself, so I'm just not entirely sure what the word limits are, but they will say so when you open it. And I think potentially in the application, the downloadable application form, I'm pretty sure we put the word limits there just to give you a bit of a guide. It's not like they won't accept more words, but it's just giving you a bit of a guide as to how, we don't need you to write thousands and thousands of word essays about what you're doing.
And then there's a question that's come through the chat, I think. Oh, it's gone. There was a question, I think it was in regards to the presentation, whether it would be available for further use. I'm assuming that's today's presentation slides.
Yes, so we will put this up as an attachment later today, or probably possibly tomorrow morning it might be, but yes, it will be up for everyone to see.
Another question. Sorry, I've missed early part of the session. Are there plans for more than one round of grants? Would next rounds be relating to community engagement?
So yeah, in the first part of the session we did talk about that. So this round is really looking at the community engagement and consultation, and then the next round of grants are really more community development grants.
Another question, on the portal, it seems to want applicants to upload a single file or zip, not individual files criterion. Can you confirm, please?
Okay, so that probably means there is just one place to put that attachment. We don't usually have an attachment to each of the criterion. It's usually just to one of them. I wish I can't open it and have a look at it while I'm talking to you, unfortunately. Sorry.
So when people go in to submit their online response, one of the criterion presumably will have the opportunity to upload a document to address that particular criterion. The other criteria, I am assuming, I haven't seen it, Donna, but I'm assuming people will need to put their response in as an online response. So you can't just upload one single document addressing all of the criteria.
No, they'd have to go into the individuals. Otherwise, we're not able to score them adequately.
Yeah. All right, so hopefully that addresses that question. We have another question. Are government organisations and local councils eligible to apply?
So yes, definitely local councils are eligible. No, absolutely.
And just a couple of comments in the chat. Can you clarify asset-based? And and then it says, withdraw that question. I can see it in the RFP doc. So I'm guessing that's been answered. Another question, are there details on what activities are part of community engagement? What activities are included in community development?
So with this particular, this round one, this community engagement is really trying to find out, it's a bit of a fact-finding mission really, to find out what the communities have been through, what sort of impact they have had with the weather events previously, and also what sort of things, including not just the physical impact, but some of the emotional impact that they've gone through. We're keen. I know we mentioned primary care providers a few times. We're keen to see how primary care providers were able to support their communities as well, and if they weren't able to, what could be done in the future. So this is around building the resilience of the community at large. So it's really quite a fact-finding mission for us to find out exactly what people have been through, what helped, what didn't help, what do they need more of. And then the second round of the community development grants will be addressing what the needs are that have come out of the first round.
So a couple of extra questions. I think one might relate to a previous question. Does the portal online response format then mean the applicant can use their own templates?
No, you can't use it. Your own templates. Hold on a second, I'm just going to stop sharing my screen. So you can't use your own templates. You really need to put things directly into the portal. The only place that you can use anything of your own is where you can upload a document.
Thank you. Another question, do you welcome submissions from organisations based outside the Sydney North Health Network area?
Yes, we do, particularly organisations that have experience in this type of engagement and consultation, and also if there's, and even more so if they actually have already done work in the region and know the region. So you're not limited if you are from outside the region.
I'm just quickly checking. I think we have captured most of the questions. People may still be posting their questions through the Q&A. A question, would you only consider organisations that were successful in round one in round two applicants?
No, in actual fact, we envisaged that that round one applicants, they may be round two applicants, but round two will be we anticipate a lot more smaller grants that would go out to work on that community development piece. So no, there's no reason why you couldn't be in both, but there will be more. We envisage to be more grants in the second round.
So Donna, I think we've captured everything there at the moment, but would you like to give people a few more minutes just to post?
Yeah, I think we will.
Questions?
It's 12:35. We've done pretty well time-wise. So I'll just give everyone a few more minutes. As I said, all the questions and answers will be written up as in the Q&A on the portal. So if you do need to leave and are worried you're going to miss something, don't panic. It will be on Tenderlink. Caroline, just saw your message about funding for round 2. That's yet to be decided. So at this point, I really can't give you a definitive answer. Sorry about that. So if you do need to leave, these will be posted up, all of the questions and answers, and as will the presentation from today. And then we just look forward to hearing from everybody putting in new proposals.